Which of the following NSAIDs is considered the gold standard for cardiovascular safety in high-risk patients? A. Celecoxib. B. Diclofenac. C. Naproxen. D. Etoricoxib. Answer: C. Naproxen. A patient with a history of peptic ulcer disease requires an anti-inflammatory. Which NSAID class is most appropriate to minimize GI risk? A. Propionic acid derivatives, ibuprofen. B. Selective COX-2 inhibitors, celecoxib. C. Salicylates, aspirin. D. Acetic acid derivatives, indomethacin. Answer: B. Selective COX-2 inhibitors, celecoxib. Which mechanism explains why NSAIDs can cause acute kidney injury in dehydrated patients? A. Direct toxic effect on the renal tubule. B. Inhibition of vasodilatory prostaglandins, PGE2/PGI2, in the afferent arteriole. C. Excessive production of thromboxane A2. D. Stimulation of the renin-angiotensin-aldosterone system, RAAS. Answer: B. Inhibition of vasodilatory prostaglandins, PGE2/PGI2, in the afferent arteriole. Aspirin is unique among NSAIDs because it inhibits COX enzymes through which mechanism? A. Reversible competitive inhibition. B. Reversible non-competitive inhibition. C. Irreversible acetylation. D. Feedback inhibition. Answer: C. Irreversible acetylation. Which NSAID is primarily used for its potent analgesic effect and is limited to short-term use, max 5 days, due to high renal and GI toxicity? A. Ketorolac. B. Piroxicam. C. Meloxicam. D. Mefenamic acid. Answer: A. Ketorolac. A patient with aspirin-exacerbated respiratory disease, AERD, should generally avoid which of the following? A. Acetaminophen, low dose. B. All non-selective NSAIDs. C. Monteliacast. D. Inhaled corticosteroids. Answer: B. All non-selective NSAIDs. Which of the following is a classic contraindication for the use of diclofenac? A. Menstrual cramps. B. Congestive heart failure, CHF. C. Tension headache. D. Osteoarthritis. Answer: B. Congestive heart failure, CHF. For a patient taking low-dose aspirin for cardioprotection, how should ibuprofen be administered? A. Take ibuprofen 30 minutes before aspirin. B. Take aspirin at least 2 hours after ibuprofen. C. Take ibuprofen at least 8 hours after aspirin. D. They cannot be taken on the same day. Answer: C. Take ibuprofen at least 8 hours after aspirin. Which NSAID is known for having a very long half-life, 50 hours, allowing for once-daily dosing but increasing risk in the elderly? A. Ibuprofen. B. Piroxicam. C. Diclofenac. D. Ketoprofen. Answer: B. Piroxicam. What is the triple whammy combination that significantly increases the risk of acute renal failure? A. NSAID plus ACE inhibitor plus diuretic. B. NSAID plus beta blocker plus statin. C. NSAID plus calcium channel blocker plus aspirin. D. NSAID plus metformin plus insulin. Answer: A. NSAID plus ACE inhibitor plus diuretic. Which NSAID is frequently preferred for treating acute gout due to its high potency? A. Indomethacin. B. Celecoxib. C. Paracetamol. D. Aspirin, low dose. Answer: A. Indomethacin. Why is aspirin contraindicated in children with viral fevers? A. Risk of Stevens-Johnson syndrome. B. Risk of Reye's syndrome. C. Risk of premature epiphyseal closure. D. Potential for permanent hearing loss. Answer: B. Risk of Reye's syndrome. A patient requires an NSAID but has a high GI risk. What is the best strategy? A. Switching to an injectable NSAID. B. Adding a proton pump inhibitor, PPI, to a non-selective NSAID. C. Using aspirin instead. D. Taking the drug on an empty stomach. Answer: B. Adding a proton pump inhibitor, PPI, to a non-selective NSAID. Which NSAID is specifically indicated for the closure of a patent ductus arteriosus, PDA, in neonates? A. Ibuprofen or indomethacin. B. Celecoxib. C. Mefenamic acid. D. Naproxen. Answer: A. Ibuprofen or indomethacin. Which of the following is not a classic sign of salicylism, aspirin toxicity? A. Tinnitus. B. Hyperventilation. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer: C. Metabolic alkalosis. Which NSAID has the lowest risk of causing GI bleeds among the non-selective options? A. Ibuprofen. B. Indomethacin. C. Ketorolac. D. Piroxicam. Answer: A. Ibuprofen. NSAIDs should be avoided in the third trimester of pregnancy primarily because they may cause A. Fetal limb deformities. B. Premature closure of the ductus arteriosus. C. Maternal gestational diabetes. D. Neural tube defects. Answer: B. Premature closure of the ductus arteriosus. Which condition is a preferential indication for mefenamic acid? A. Primary dysmenorrhea. B. Chronic migraine prevention. C. Rheumatoid arthritis maintenance. D. Acute myocardial infarction. Answer: A primary dysmenorrhea. Topical NSAIDs, e.g., diclofenac gel, are primarily used to A. Replace oral NSAIDs for systemic inflammatory diseases. B. Provide localized relief with minimal systemic absorption. C. Treat internal organ inflammation. D. Prevent cardiovascular events. Answer: B. Provide localized relief with minimal systemic absorption. Which enzyme is constitutive, constantly active, and maintains baseline physiological functions? A. COX-1. B. COX-2. C. COX-3. D. Lipoxygenase. Answer: A. COX-1.